Hello, I'm Dr. Bishyas. I'm a doctor of this clinic. I confirm that you are Mr. Nicholas Salt, 30 years.
Yes, doctor.
Okay. I got a letter from your GP saying that you have jaundice and some problem with your bowel. Is that right?
Yes, doctor.
So can you please tell me in your own words what has happened to you?
Well, doctor, it's actually not a new thing, doctor. For the last 3 years, I have been facing sometimes this yellow discoloration of my body, in my eyes. Okay. Uh, um, these have been, I think, 8 to 9 times in the last 3 years. I have been facing this, and whenever I feel this yellowish discoloration, I also have some itching in my whole body. Okay, and itching in my whole body, and at times, sometimes I also have some raised temperature, and so this is bothering me. And also, I have some problems with my bowel movement. I think I also have passed blood for the last 1 year, I think. So this is also a bit bothersome. I'm really sorry to tell you that I fear I have cancer.
Yeah, I'm extremely sorry to hear that, and let me find out what has happened to you. And after that, I think I will be able to give you a better solution. So I'm coming with a jaundice. You said that for the last 2 years you have about 9 times jaundice.
Yes.
And during that you have also some itching. Can you tell me that for how long it persists?
I think, doctor, this jaundice persists about for 4 to 5 days.
Okay, and what do you feel during the jaundice? Any changes in the color of your water work or changes in the skin?
I think, doctor, the waterwork is a bit darker, doctor.
Okay, and other time you are normal.
Yes, doctor, quite normal, doctor.
Okay, are you getting paler during this time?
I haven't noticed it actually, doctor, that much.
Okay, and you feel some scratch during the jaundice episode?
Somewhat.
Any scratchy or itching?
Yes, I told you, doctor, that there is itching in the whole body.
Okay. Do you notice any changes in your weight?
I think, doctor, I have lost some weight for the last 6 months.
And or is it unintentional?
Yes, doctor, unintentional.
What about your appetite?
Quite good, doctor.
Okay. Have you noticed any lumps or bumps anywhere in your body?
No, doctor, no lumps and bumps.
Okay. And you have bowel problem for last 1 year, and you have sometimes passed blood in your bowel.
Mm.
Do you have any constipation?
No, doctor, no constipation, doctor. But at times I have some tummy pain, some cramping pain in my tummy. Okay. And so I also sometimes have felt that I pass some fresh blood. Okay. For the last 1 year, I have actually felt that over 10 times I have felt this. Okay. So
Okay.
that's really bothering.
How frequently you pass your bowel?
Doctor, I think around 4 to 5 times a week.
Any passes of bowel at night time?
Well, doctor, I have noticed that not very much, but few times.
Okay. And any loose motion?
Doctor, not that much,
Okay.
but at times it occurs. But I'm actually worried more about the blood.
Okay, I can understand. And any changes in your water work?
No, doctor.
Okay, any changes in your vision?
Doctor, I think 3 times I have had some red eyes.
And was it treated?
Doctor, it went out on its own.
And for your jaundice and for your bowel problem, did you seek any medical attention?
No, doctor.
Okay.
I actually didn't give it any credence.
Do you have any rash anywhere in your body?
Yes, doctor. Yes, yes. That's another thing. I have some rash in my legs, and these are very bothersome to me, doctor.
Can you show me that?
Yeah, doctor.
Okay. And for how long you are having this?
I think I've been having this for the last 3 months.
Okay. And did you start following any injury?
No, no.
Is it increasing?
Yes, doctor, it's increasing day by day, doctor, and
Okay.
it's look very ugly.
Do you have any past medical condition?
Doctor, I don't know of any.
Okay. Do you take any medication?
No, doctor.
Okay. Can I examine you now?
Yeah, yeah, doctor. Yeah.
I want to see your pulse.
Yes, it's normal.
Okay. And I want to see any signs of rheumatoid, any joint pain. Do you have any joint pain?
Yes, doctor. Some joint pain in my back.
Okay. For how long?
Doctor, for the last 6 months.
Okay. And may I know that for a few personal question that any of your
Yeah.
family member have this type of condition? Any
I
disease?
don't know of any, doctor.
Do you smoke?
Yeah, no, doctor.
Do you drink alcohol?
No.
Okay, that's fine. And now I am going to see your eyes if there is any
Yeah.
redness or
Jaundice,
any.
deep jaundice present.
Okay. And at the time I want to see. Can you show me your tongue?
Yes, it's yellowish.
Okay. And I want to see any rash in his mouth.
No, my rash is present. But I had some rash previously.
I want to see the tummy if there is any lumps or any tenderness.
But there is some tenderness in the left side.
Okay. And I want to see examine the rash. 2 minutes remaining.
Yes.
I need a gloves for examining his rash.
Yeah. You can have it.
Okay. And its base. I want to examine its base. And do you feel any tenderness? And also skin
Yes,
around
it's
the area.
tender. It's tender.
Okay. May I know that what is your concern? One concern was that you are probably thinking of cancer. And
Yes, doctor.
as I
Am I
have
going to
taken
die,
your,
doctor?
yes, I can understand your concern. As you have taken your, I have taken your history. I have examined you. I need to run some tests to be sure for that. And till now, I think that you probably have a condition called inflammatory bowel disease. Have you heard of it?
No, doctor. I haven't had that. Oh, is it something serious?
Okay, actually, this is a condition that can be serious if it is not treated, and we have a good treatment option for that. But before we are sure what happened to you, we need to run some blood test, run some imaging test. Okay,
Yeah.
I think that this bowel problem is related to your ulcer and also related to your jaundice problem.
Okay. So why this jaundice, doctor? Why is happening?
Sometimes this type of disease that your bowel have, this can affect other parts, like you have joint pain, you have rash in your eyes, and this also affect the liver.
Okay, doctor.
And do you have any question for me?
No, doctor. Thank you, doctor.
Yeah, I am going to admit you, and I am going to run this test for you. Do you have any problem with that?
Can't you just send me home?
Okay, actually, this type of treatment needs urgent evaluation. Time off.
Okay. Okay. So what's the diagnosis here?
I think this gentleman is suffering from inflammatory bowel disease, most likely ulcerative colitis, which has complicated a condition that is likely to be primary sclerosing cholangitis, and
Okay, that's all right.
that
And
continues. I am considering it is also associated with pyoderma gangrenosum. But I also have some other differentials. Like I am also considering it can be a case of autoimmune hepatitis or primary biliary cirrhosis. And also, I would have asked more about his jaundice if what was it following any uh, type of food intake that is for any viral hepatitis,
yeah.
any injectable drug he takes. I really didn't get time for that.
Yeah. Okay, that's all right. And how would you investigate the patient?
I will go for the baseline investigation, complete blood count to see anemia and white blood cell count level to see any infection, then inflammatory markers, ESR and CRP. After that, go for the liver function test with serum ALT and serum AST and serum gamma GT level, serum bilirubin level, and
What do you expect here?
I think all of them will be raised.
Okay, most frequently ALP and GGT. These two are very more important for
Okay.
raising and bilirubin. Okay.
Okay.
Yes.
And
Okay. And
after that,
then
I will go for the synthetic function test with serum
very good.
albumin level and serum prothrombin and also running the prothrombin time. And after that, I will go for the specific test like anti-nuclear antibody, anti-mitochondrial antibody, and serum IgM level and EM2 mitochondrial antibody.
Mm, mm, mm,
And
mm.
also I will go for the uh, urine routine examination and stool for calprotectin level, and also after that I will consider uh, first GI endoscopy and also colonoscopy with biopsy if needed. And if
Okay. What would you wish to find in colonoscopy and biopsy?
Okay, colonoscopy may show the ulcerative colitis with extensive ulceration in the distal colon, including the rectum.
Yes, always the rectum. Is it continuous or non-continuous?
Usually, ulcerative colitis is continuous.
Okay, that's very good. That's very good. And how would you plan to treat the patient?
Okay, but it is actually a multidisciplinary approach. First, I will educate and counsel the patient about this condition, and then I will involve the hepatologist for his liver involvement, and then I will involve the gastroenterologist for his ulcerative colitis, and as he and also I will need some from input from the physiotherapist, and also involvement of the ophthalmologist as
Okay, okay, that's all right. That's all right. I can get it. And you told that it can be primary sclerosing cholangitis. Am I right?
yes, as it is
Associated with
autonomic.
IBD. Okay, okay. Yeah, yeah. So, okay, can you? That's you have done actually very well. I think you have done very well. Now let's discuss some topics. Okay, and one thing, if you ever think that PSC might be a cause, okay, I think you should tell about MRCP. This
Okay,
investigation.
yes, yes,
Okay?
I forgot that.
Yes, you should. You should.
Ultrasonogram of the liver and
Yeah,
MRCP, and
ultrasonograph
after that
should be
biopsy
added.
and
Yeah,
liver biopsy.
yeah, yeah. Ultrasonography should be added, but MRCP is very important because there can be both intrahepatic and extrahepatic dilatation present.
Yes,
Okay,
yes.
in PSC. Okay, that's one thing. And other thing was here when you go to the treatment for PSC, I think you at least should tell the word about RC-deoxycholic acid. Okay, this is the prime treatment here. Okay, you just should use the word here. That would be important. Okay.
Okay.
And otherwise, it's fine. For itching, you can use cholestyramine, and for IBD, this specific treatment. Now, there is one thing that I told you, and actually, I missed a point. I actually made a mistake there. I told that I I opened a bowel 4 or 5 times a week. Actually, that was a mistake. I was going to tell 4 to 5 times a day. Okay, okay. So at that time, there is actually a severity range of IBD, of ulcerative colitis. Okay, like how many times are you opening the bowel? It's mild, less than 4, moderate 4 to 6. Okay, severe greater than 6. Then there are also some other parameters there like albumin, hemoglobin level, ESR. Okay, so pulse rate. So now this is also important to check the pulse rate. Suppose you are getting that he is opening a bowel for greater than 6 times, and his pulse is more than 100. Suppose, okay, okay, are you getting it?
Yes.
So that is important for in the examination part, because then it would be considered a severe case, and in that case, the severe, very quick management is needed, like IV fluid, IV nutrition, nutrition is needed, immunosuppression with steroid, okay, and antibiotics, IV antibiotics, all this should be covered up. Okay, these things you should have, you could have mentioned, or this is just maybe just for the academic purpose if the patient comes is in this stage or in that state. Okay, and for pyodermal gangrenosom, you can tell that dermatologist can also be involved. I'm not sure, and I forgot whether you remembered about dermatologist. I cannot remember. Have you told it?
Sorry.
Have you told the multidisciplinary team consisting of dermatologists also? I cannot remember.
Okay, I forgot.
Yeah, you should have told about hepatologist, gastroenterologist, and dermatologist. Okay, and physiotherapist and occupational health therapist if needed. Okay.
Okay.
Yes. So, can you remember of anything else now for the discussion part?
No.
Okay. I think you can just stop the the recording.
Hello, I am Dr. Vishwas. I am a doctor of this clinic. I confirm that you are Mr. Black and I'm 28 years.
Yes, doctor.
Okay, I got a letter from your GP saying that you have some shortness of breath for last few months. Is it right?
Yes, doctor.
Okay, so can you please tell me in more details what has happened to you?
Okay, doctor. I think for the last few months, I have been facing some shortness of breath. Actually, doctor. Okay. At the beginning, I didn't take it very seriously, but as the days are progressing, I think that it's getting more and more severe, and I am also feeling that I am suffering from some cough. Okay. So what's going on, doctor? I don't know. And am I having some problem with my heart or anything like that?
Okay, let me find out what has happened to you. And you said
Okay.
that you have shortness of breath. And did it start suddenly or gradually?
It's gradually, doctor.
Okay, and do you feel shortness of breath all the time or just any particular time of the day?
I think it's more when I do some exercise or something like that.
Okay, and anything makes it better? Have you noticed anything?
Doctor, I haven't noticed, doctor.
Okay, have you noticed any shortness of breath at night?
Doctor, I couldn't notice, doctor.
Okay, that's not a problem. And you said that your shortness of breath comes when you do any exercise. And have it when you are at rest?
Doctor, one or two times, but I think it's more while I do some exercise.
Okay, and how long or how far you can do your job without having this problem?
I can do my jobs, doctor. There is no problem with that, but I feel that I have some shortness of breath, some discomfort in my breathing. Okay, I can do my job. It's not that I cannot do whatever I'm doing. I can do it.
Before having this shortness of breath, did you have any other abnormal events like any fever or anything else?
No, doctor, but sometimes for the last 4 or 5 months, I think I sometimes I feel that I have some raised temperature. Although when I'm measured, it's very less. It's usually within 99 to 100 degree.
Okay, and for this time you have also cough.
Yes,
Do you
doctor,
feel
some cough.
cough all the time, all the day?
Doctor, more it's increasing now, doctor, as the days are going by.
And how
That's
frequently do you feel the cough?
actually almost every day, doctor, now.
Okay, any nighttime cough?
Sometimes, doctor, sometimes.
Okay, and any cough during your work or you feel better at night? Have you noticed anything like that?
Doctor, it's not the specific time, doctor. I cannot specify that.
Okay, do you produce any phlegm?
No, never.
Have you ever coughed out any blood?
No, doctor.
Do you have any noticed any changes in your ankle or in swelling in your legs?
No, doctor, no swelling.
Do you have to wake up at night due to cough
No,
or
no,
shortness of breath?
no, no,
Okay, do you have any headache?
no.
Any shortness of any redness in your eyes?
Doctor, once only, one time I had.
And did it went away on its
It
own?
went away on its own, doctor, but I suffered a bit.
Okay. And do you have any rash anywhere in your body?
Yes, doctor, yes. That's another issue, doctor. As you can see me, I have some problems in my nose.
Okay, I can see. For how long you have this?
For the last 4 months, doctor.
Okay, and do you have any pain
Where, doctor?
on your nose?
Yeah, doctor, sometimes I feel some pain.
Okay, any crusting or anything comes out from this?
I haven't noticed, doctor.
How about your weight?
I think, doctor, I have lost some weight. I cannot surely tell you, but I think so.
Any hot or cold preferences?
No,
Any nighttime sweats?
I haven't noticed.
Okay. Any pain in your tummy?
No, doctor.
How about your water work?
Well, doctor, I think I have to go more frequently to water for my water work, doctor.
Any pain in your tummy?
I haven't noticed, doctor.
Any weakness at any side of your body?
Uh, no, doctor.
Any joint pain?
Yes, doctor. I
Where?
have some pain in my joints.
Do you have any
Uh,
morning stiffness or any stuffiness in the morning?
doctor, I think that I have some morning stiffness, doctor.
For how long?
Well, I think about 30 to 35 minutes.
Okay. And have you noticed anything that makes your pain, joint pain better?
Doctor, actually, the pain is not that serious, doctor. So I haven't. I'm more concerned about my shortness of breath. So I couldn't.
Do you have any
Uh,
past medical condition?
I don't know, doctor.
Do you take any medication? 2 minutes remaining.
No, no, no,
Okay. And any of your family member have this type of condition?
no, doctor.
Did you ever visited outside the country?
No,
Any contact with the TB patient?
no.
Okay. Can I examine you?
Yeah, yeah,
I am going to see your hands for the joints. Can you show me the where do you feel the pain
yeah,
in
yeah.
the joints?
I think it is a bit uh, pain all over the hand, but not very severe.
Okay, and I am going to see the pulse at the same time. I am going to see the eyes for any redness, and I am going to see if there is any anemia, and I can see
Hmm.
the nose. And after that, I will need to gloves to examine it.
Okay. At first, in the pulse, when I told you, it is a bit slow, 50 beats per minute, and eyes are normal, and nose, and you can use the gloves now.
Okay, I'm seeing into the nose for any bleeding or any crusting point. Okay, and after
No
that,
bleeding.
can you show me your tongue?
Yeah, it's normal.
I am going to see listen the lung.
Yeah, there is a
Left.
bilateral 5 kips.
Okay, and listen the heart.
Bradycardia,
Okay,
50 beats.
may I know that do you smoke?
No, doctor.
Okay, that is fine. And at this point, do you have any concern?
Well, doctor, what is going on with me? What's
As I
the
have
problem?
taken your history, I think that you have a condition called sarcoidosis. In this condition, our own body defense attacks some tissue, and then this type of condition appears. And I have examined you, and it seems likely that it has affected your eyes, your nose, and your lungs. For affecting the lungs, time up.
Okay. 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 So, what do you think your diagnosis is?
For this gentleman, my diagnosis is this is a case of sarcoidosis with presence of lupus pernio with then with bilateral upper lobe fibrosis.
Okay. Okay. And what disease can be brought out?
Mm, okay, and for this, I will also consider tuberculosis.
Okay. Suppose that. Okay. I'm sorry to interrupt you. Suppose it is tuberculosis patient. Suppose,
Yes.
and there is the similar type of rash. Then what would you think? What would you tell it? This rash,
Okay, I think
almost similar rash.
yes, I forgot the name.
Lupus vulgaris.
Lupus
Okay.
vulgaris. Yes.
Okay. Okay. Other.
The differentials are rheumatological condition like systemic lupus erythematosus,
Yeah.
rheumatoid arthritis.
Okay. And any drug cause?
I cannot remember.
Yeah. Yeah. Okay. That's all right. But since you told about bilateral fibrosis, so I asked about drug cause. So there can be some drug causes like methotrexate, nitrofurantoin, like this amiodarone. Okay. Okay. For
I think they involve the basal region.
yeah, yeah. I think some can involve. I am not sure. I can just for fibrosis purpose. But if there are two important actually DDs that you haven't told. You can tell about contribution disorder, that's well, but I actually want to say, because this should have been included in the history part, like occupation, silicosis, that would
Yes.
have been important. And another thing, pet exposure, extrinsic allergic alveolitis. Okay,
Okay.
so this DDs I think should have been brought. Okay, and others you have excluded, like nasal crusting, so that venous granulomatosis or something like that. You have actually, in any case of shortness of breath, what we forget is that TB, sarcoidosis, extrinsic allergic alveolitis, silicosis for occupational exposure, and this type of vasculitis like venous granulomatosis or something. These sometimes we forget, I think. Okay, so all
Okay.
these should be covered. And what investigations should be done?
Okay, but I will go for the complete blood count to see anemia and white blood cell count level to see any signs of infection, and then I will go for the inflammatory markers. After that, renal function test, liver function test, and serum angiotensin converting enzyme level. And after that, I will go for the bronchoalveolar lavage for lymphocyte ratio, especially CD4 and CD8 ratio. And
Very good.
then I will also go for the biopsy from the lungs to see any granulomatous change, and biopsy from the nasal region.
Okay, okay. I have one question here. I have one question that what change can you find here?
I think it will bring the specific cells for
Non-cascading granuloma.
Yes.
Okay, non-cascading granuloma. Now, if I ask you that, can it be TB in non-cascading granuloma?
Actually, tuberculosis is cascading granuloma.
Okay, just for academic purpose, you should let it know that it can be TB. Okay, TB is consists of two tubercles, hard tubercle and soft tubercle. If it's soft tubercle, it's non-cascading granuloma. Okay.
Okay.
Okay. And any other investigation?
Okay, I will then after that I will go for the imaging test like chest X-ray, and then ECG of the heart, and echocardiogram. Then I will also go for the urine for routine examination, and also serum electrolytes, and
I think that's enough. I think that's enough. But chest X-ray and a high resolution CT scan. Okay.
yes.
For to see any fibrotic changes, since there are some chance of fibrotic. And how do you manage it?
Yeah, actually, this is a multidisciplinary approach. First, educating and counseling the patient, and after that, is this patient have lupus pernio and bilateral upper lobe involvement, and for this I need to involve the rheumatologist, that then respiratory physician, then also dermatologist for his reconstruction of this shape, and any involvement of the surgeon. And also I will involve the physiotherapist for this.
Okay. Okay. And okay. And actually, do you all think that always treatment is needed in this patient?
This gentleman actually asymptomatic patients with sarcoidosis or any without any lung involvement patient, it can go without treatment, but this patient have history of uveitis and also have lupus pernio with involvement of bilateral upper lobe. This patient definitely need treatment.
Okay. Okay. So thanks a lot, doctor. Okay. Okay. So do you yourself want to add anything to the discussion?
No, actually, these cases had huge questions. So
Yeah, this actually is a huge question. But anytime I think whether we find fibrosis, I think we should rapidly go into the drug cause, into the connective tissue causes, and this sarcoidosis, TB, extrinsic allergic alveolitis, and silicosis. So because of occupation and pet history, I think this may be important. Are you in uni? Do you think the same, or do you want to add
yes,
anything?
I should have
Because
asked about the occupation.
yeah, occupation and pet. Okay.
Yeah.
So if this were us, then I think you could have covered all the DDs. Okay.
Okay.
So, and do you want to add anything now?
No.
Okay, I think you can stop.